A 60-year-old male patient is admitted with recurrent retrosternal chest pain of 3 to 5 minutes duration that responds well to sublingual nitrate. His TROP1 is normal. ECG shows LVH with flattening of T waves. His current medications are aspirin, statin, metformin, and metoprolol 50 mg. What is the next step? The choices are A. Increased dose of metoprolol, B. Low molecular weight heparin subcutaneously, C. IV nitroglycerin drip, and D. Add clopidogrel. Now let's look at the salient points. 60-year-old male, recurrent retrosternal chest pain that responds to sublingual nitrate. These features suggest myocardial ischemic pain. His TROP1 is normal and ECG shows left ventricular hypertrophy with T wave changes. So, with these points, the diagnosis should be acute coronary syndrome, unstable angina, the treatment of which is low molecular weight heparin subcutaneously. So, the correct choice is B. The three types of acute coronary syndromes are 1. ST elevation myocardial infarction, 2. Non-ST elevation myocardial infarction, and 3. Unstable angina. In STEMI, there is complete block of a major artery, whereas in non-STEMI, there is only partial block in a major artery or complete block in a minor artery. In both, cardiac biomarker, that is TROP, is elevated. But in STEMI, there is ST elevation, whereas in non-STEMI, as the name suggests, there is absence of ST elevation. How do you differentiate non-STEMI from unstable angina? By the cardiac biomarkers. It is elevated in non-STEMI, whereas it is normal in unstable angina. ECG changes are present in both. In ST elevation MI, there is complete block of a major artery, whereas in non-STEMI, there is only partial block in a major artery or complete block in a minor artery. And as mentioned before, in unstable angina, there is no elevation of cardiac biomarkers if done by the traditional troponin assays. But if you do high sensitivity troponin assays, troponin is almost always raised and the diagnosis would be changed to non-STEMI in almost all patients formerly diagnosed with unstable angina. So, if you do high sensitivity troponin assays, diagnosis of unstable angina is rare. Anyway, the distinction between non-STEMI and unstable angina is not that important because the treatment is the same. The reperfusion strategies: 1. Anticoagulation as soon as possible after the diagnosis. You may use unfractionated heparin, enoxaparin, bivalirudin, or fontenoparax depending upon various circumstances. Second is platelet inhibition and percutaneous coronary intervention in selected patients. Remember, patients with non-STEMI should not be treated with fibrinolytics. The three indications for giving IV nitroglycerin in acute coronary syndrome are: 1. Persistent pain after 3 sublingual nitroglycerin tablets, 2. Hypertension, and 3. Heart failure. In our present case, the patient has already responded to sublingual nitroglycerin, so IV nitroglycerin is not indicated. The three indications for giving IV beta blockade are: 1. Ongoing chest pain, hypertension, and 3. Tachycardia not caused by heart failure. This patient in the question has already been on beta blockade. There is no indication for giving IV beta blockade or increasing the dose of metoprolol.